Good morning. Welcome to House Labor, Health and Social Services Committee. Good morning, members of the committee and members of the public. Thank you for joining us. Mr. Caldwell, LSO, and our intern, good morning. Thank you for joining us. Mr. Caldwell, if you'd call the roll.
Representative Clouston. Here. Representative Guggenmoss. Representative Heft. Here. Representative McCann. Here. Representative Ottman.
Here.
Representative Thayer.
Excused.
Representative Wasserberger.
Here.
Representative Yen. Chairman Rodriguez Williams. Madam Chairman, we have a quorum.
Thank you. All right. This morning we have two bills on the agenda. We have Senate File 48 Stem Cell Freedom Act and Senate File 19 epinephrine delivery methods. Just a friendly reminder for those that are joining us this morning, we do have rules of decorum. They're listed out front of the meeting room. I just ask that everybody silence their cell phones, including members of our committee. And those that plan to testify, please address the chair. With that in mind, we'll go ahead and move forward with the agenda, and we'll put Senate File 48 on the table for consideration. The bill sponsor is Senator Barlow. Good morning and welcome. If you'd state your name and walk us through your bill.
Good morning, Madam Chairman, members of the committee. Excuse me. Thank you for the opportunity to be with you. Eric Barlow, Senate District 23. It's nice to be in the Powder River room. Here we are, my home country. So thank you for your opportunity to present Senate File 48 today. Members of the committee, there's several folks who have personal experience with this bill and the impacts that this bill could have. So I'm going to actually try to keep my comments fairly brief and let them come forth and share their personal testimonies because I know you have a busy schedule. You do have an engrossed copy before you. There was one very modest, I would say, amendment made in the Senate that provides some, I guess, transparency to the bill is maybe the best way to describe it, but otherwise the bill stands as it was when it was introduced. So Madam Chairman, at your pleasure, I can give just a brief overview and then walk through the bill and then turn it over to you, the committee, for questions. What's your pleasure?
Yes, please give us,
okay, thank you.
Walk us through.
So Madam Chairman and members of the committee, for the last year and a half, almost 2 years, I've been listening and hearing from folks in my community that have an interest in pursuing regenerative medicine. Regenerative medicine is a broad category of different modalities, healthcare modalities. Some of you are familiar with some of them. Stem cell happens to be one of those different modalities, stem cell therapy. And instead of maybe bringing in an umbrella type bill, we decided to just focus on something that maybe we understood the best. We could move forward in the cleanest way. So what this bill is make an effort, and this is basically a right to try bill. Right to try, as you know, Wyoming passed right to try in 2017-18, and then the federal government passed right to try. Now this takes right to try and applies it to stem cell therapy without the nexus of having a terminal disease. So right to try was based on if you have a disease and there's no other therapy or treatment, you could try some drug that had not been fully approved. Now we're taking stem cell and applying that same standard, stem cell therapy. And so what this bill, I believe, accomplishes is it provides safe healthcare or provisions of safety in a legal framework, right to try, and with ethical standards. Those are the three things I believe this bill delivers in this process. Now, other states have taken other avenues to get to here, but they've been broader beyond stem cell therapy. They've been in the regenerative medicine category. And so they're not, I would respectfully say, not as refined, and they're having challenges actually standing up regulatory mechanisms. We're trying to avoid all the regulatory mechanisms we can possibly avoid. Wyoming not getting in the way of this. So Madam Chairman, I believe this provides a framework for powerful medicine for healing our bodies. And I believe there are other people who maybe speak to the science of it. I can certainly go into some of the science of it, my understanding of it. But what we're trying to do here is find that correct regulatory framework. So Madam Chairman, I'd be glad to take any questions on that opening, but I'll just go through the bill quickly and try to highlight some things in the bill. Your pleasure.
Yes, please, Senator.
Okay. And I'm going to have two versions of the bill up here because my notes are in the Senate version and the engrossed version but I think, so first of all, as a bill, most bills do, they create definitions or they provide definitions for statute. And you'll see good manufacturing practices, institutional review board, investigational drug physician. This bill is limited right now to only physicians can provide this type of therapy. We did not take it to mid-levels, and I know can be certainly a discussion about that. But because we're going under this legal framework of right to try, we want to keep the standard as high as possible for this right to try. So, and then we get to stem cell therapy, which you'll see on the bottom of your bill, page 3, is the definition of stem cell therapy. So there's several things to highlight here. The first one is line 21, autologous. This is your cells for your body, for your healing, period. There is no, if it said familial, that would be your cells for a child or for a parent. If it said allogenic, it would be human cells for humans. But this is only your cells, Eric Barlow's cells for Eric Barlow's healing purposes, period, the way this bill is drafted. So mesenchymal cells, those are cells that have the potential to differentiate at some point based on how we would process them, et cetera. Now, probably the most important thing is, and some of you all know, you can see advertisements right now that says we're giving stem cell therapy, right? We see that out there. So let's take a look at the lines 22 and 23 in the bill. What I believe you can receive right now is the collection and the therapeutic. So that misses processing, cultural expansion, manufacturing, and storage. Right now, and this is FDA rules, Food and Drug Administration rules, 351 versus 361. One says minimally manipulated, and one says you can actually do more with the cells. That is the difference that this bill does. So what is out there right now is minimally manipulated cells. So it's out of your bone marrow into a joint with no other. This bill, the way this definition is you could take those cells, you could grow them out and have a dosage or have multiple dosages and store those cells for subsequent treatments. That's the significant difference that this bill provides that is not provided in what is out there right now. Now, to be clear, this bill does not stop what's going on out there. We'll get to that part of the bill. Anybody that's practicing that wants to continue what they're doing right now, that's part of it. This takes it a step further. And the step further is FDA is not keeping up with the science and people are leaving this country to try to find those treatments. And you'll hear testimony to that extent. So Madam Chairman, maybe it's a good time. I'll just stop there on that definition because I think that's a key component of this. Your cells, your use, and having broader ability, more ability to actually take those cells, expand them, grow them, and then store them and then use them in subsequent treatments, which currently is not being practiced in Wyoming or technically in the United States because of the FDA limitation, Madam Chairman.
Committee, any questions at this point of Senator Barlow? Vice Chairman Ottman.
Thank you, Madam Chairman. Senator Barlow, just to clarify, I know you said it, but I just wanted to clarify it in my mind. If with this new type of stem cell collection, that's only for your treatment, does that have to be administered by a physician? Is that collection in a doctor's office? And also, so you can't distribute that to someone else or sell it?
Senator?
Yes, ma'am. Yes to all of those questions, and we'll get to the details in the bill about who can be the provider and then where they are. But yes, they are your cells for your use, period. Thank you.
Any additional questions? Representative Watzenberger.
Thank you, Madam Chair. Yeah, thank you, Senator Barlow. just you were mentioning having that scope of just being under physicians. Do you know if in those other countries that they sometimes have them practice under nursing practitioners or other staff members besides just physicians? And
Senator Barlow?
Madam Chairman, thank you very much for the question. I do not know the answer to that, but they also have very different regulatory processes. Their federal government, for lack of a better word, has different. Right now, we have limitations, and if we're going to base this on right to try, from my perspective, you have to start with the highest level of training, and then as we expand, or the FDA expands, the way this bill is drafted, that can automatically happen. So if it's anyway, so this bill, I believe, allows, the FDA changed how they approached it. This bill would allow that to take place, and we wouldn't actually have to come back and change the legislation. So it opens that possibility. Thank you, Madam Chairman.
Follow-up, Representative Wasserberger.
thanks, Madam Chair. Do you know what's the most common type of treatments people leave the country for to get this type of like what is the disease or condition that they're dealing with?
Senator Barlow?
Madam Chairman, I think what you'll hear most about is orthopedics, joints, things like that, but certainly there are others as well. And I think you're going to hear some of those today in the testimony. Thank you, Madam Chairman.
Any additional questions at this point, committee? Okay, seeing none, if you continue
Yes,
with the
ma'am.
bill.
Thank you. Madam Chairman, if we go to the, now we'll go through this, top of page 4, just for clarity's sake, we put in no materials from an abortion. Now, autologous, I think, takes care of that, but we just reinforce that. Other states are allowing, including the state, couple of states next door, are allowing umbilical, et cetera. This bill does not. This is autologous. Now, you can have an interesting discussion whether umbilical for a child that's born, whether that would be autologous, and that would be an interesting discussion. But for right now, we just want to be clear that no tissues, biological material from an abortion. Now we're going to go into, Madam Chairman and members of the committee, 1103, and this is the check marks. This is the boxes that if you are following this, you can practice, you can provide stem cell therapy, and I'm going to call it stem cell therapy 2.0, 3.0. We already described we can have basically 1.0 right now. We're actually trying to raise the bar, and these are the bars that state of Wyoming, at least the way this bill is drafted, and I'm confident, give the safety aspects, the legal protections, and provide those ethical considerations as well. So the first one, you'll notice, first of all, we're giving authority for a patient to receive and a physician to provide stem cell therapy straight out the gate. And then here are the conditions. This goes to the right to try. Either you have a current IRB, Institutional Review Board approval, or you're an investigational drug, phase 1. Now, as you recall, both of those are in the definitions, so those can be referred to. They're not analogous to each other. One is actually a little prior to the other, but right to try requires that phase 1 approval, which is safety, patient safety. IRB basically is the oversight body that gets you to that phase 1. So we're actually trying to back it up half a step, if you will, to have broader access. And I'll stand for questions anytime, Madam Chairman. The next, Romanet 2, good manufacturing practices, also in the definitions. This is, are we handling the cells in a way that prevents infection, prevents, the introduction of a contagious contaminant, E. coli, whatever that may. Are we handling these cells in a way that you can actually put them back in somebody's body safely? And these first two, both the IRB and the good manufacturings, those are standards, federal standards. We're not giving them, they're not licensing them, but they are federal standards that folks would have to apply for. The next one, top of page 5, is, of course, you have to have a relationship. We don't need drive-through healthcare in Wyoming. This is serious healthcare. Let's be serious about it. Let's have a relationship with your physician. And so, and that's actually in the Medical Practice Act as well. So it's nothing new. The next one is what was actually added. This is lines 5 through 7. This was added in the Standing Committee Amendment. And to be clear, we knew we needed to do this. We were trying to get the bill drafted and out the door so people could give us comments and feedback a couple weeks before the session. We knew that we needed something and we just didn't quite have the details worked out. So this is what we came back with is you just register with the state board that you're doing this, practicing this medicine so that a potential patient can know that, yes, in fact, you've said you're going to adhere to these standards. That's it. That's it. That's all it's doing. It's not telling you what protocols, it's not telling, you're not having to tell the board what you're doing or anything, that you are going to practice in this space. That's all it's doing. And I believe you'll hear from the state board executive director that it fits into their licensing process. They can just add a box, check the box. We're providing this. I don't believe there's anything. Hopefully that's what he'll testify, that there's no additional concerns. And then we get to lines 9 through the rest of the page, onto the next page, and that is the informed consent. These are the things that the physician, written informed consent acknowledging what they're getting, that it's not approved by the FDA, not fully approved, that what the risks and benefits are, and that there is, even though these are under investigational or IRBs, that the provider will be charging for them, can charge for them. Generally in investigational things, there is not a charge. You're part of a study. But this is providing healthcare, and folks will have a financial responsibility. If there are no questions there, Madam Chairman, I'll continue. This goes to one of the questions, Representative Ottman. This is page 6, lines 5 through 9, a physician. This is for the actual administration of the stem cell therapy, the administration of it. Now, for all the other things that we can do, remember we were processing them, we were storing them and all those, that can be done under the supervision of a physician. So you could have your nursing staff or PA or whoever else you wanted in your clinical setting take care of those responsibilities, but still trying to keep that highest bar of healthcare oversight in a physician. Continuing on, C, if you're not authorized to do this, there are times, and you'll hear, I think this from the medical board, say, hey, I want this treatment and my doctor is refusing to give it to me. And there's a complaint or there's a concern. Well, and some may have heard this before in your practices. No, I don't believe in that, or I'm not comfortable with that, or I'm not trained for that. So this just says, look, if no one can force you to do this, you're a physician, you can't be forced to do it. So that leaves that discretion to the healthcare provider. The next one is insurers can provide coverage, or they're not, but they're no obligation. Same as right to try. And then the bottom of page 6 onto page 7 is probably one of the most important things, besides laying out the check boxes, is and this is what I talked about, if you're already doing stem cell 1.0, you can continue doing that. If it's allowed by law, you can continue it. This also means to me that if the FDA says, okay, we're gonna find a way to do 2.0, 3.0 stem cell therapy, this applies too. So the federal government adjusts their limitations right now. This bill, we don't have to come back and say, oh, we got to fix this. This actually gives that relief valve if federal government ever catches up, which I don't have confidence in, but if they catch up. So this gives that release valve. And then what it also is, obviously the second sentence is, if you can't tell people you're practicing under the act if you're actually not registered with the board and doing what this act says. And then the rest of the bill, Madam Chairman, is almost identical to Wyoming right to try and federal right to try. So the actions against the physician's license, you'll hear about maybe some comments on that. And I'll go to line 10 of that. This is page 7, line 10. And this is, the Board of Medicine is limited to take actions solely for right to try stem cell therapy, right? If the physician is doing other things that are unethical, they have every right to take that up, but it's only for this particular thing, as long as they're following this act. So that solely language, and I think you'll hear that coming up. The rest of the bill, quite honestly, Madam Chairman, with a few adjustments for verbiage, is exactly what current right to try is in Wyoming statute, and including the cause of actions. And then the last page, you'll see the new language on page 8. This is just giving the Board of Medicine the obligation and the authority to have that public registry where the physician can say, I'm going to be providing this type of treatment. So with that, Madam Chairman, effective date is the normal effective date. I'd be glad to stand for any questions. Thank you very much.
Thank you, Senator. One quick question, and I'll head to yours next. Has there been any push at the federal level to move towards 2.0, what you're referring to as 2.0 or 3.0? Push towards it on the FDA?
Madam Chairman, in December, I was in HHS headquarters. And yes, they are trying, they are working. It's a big agency. I was going to use a different word for it, but it's a big agency. And there will be, I think we will see something in the next year or two, but there's a lot of things that they're working through. And there are a lot of other folks, just to be clear, this didn't get dreamed up out of my head. There's a lot of other folks, scientists, physicians, et cetera, that help put this together and put this approach together. And they are also pushing and working and have connections within HHS and FDA to move this forward. And other states, just like Right to Try came about because states started adopting it, right? They started adopting Right to Try, and the federal government responded to that. This is a similar effort. States are doing this, Montana, Utah, Florida, Arizona, in different ways. As I said, they're doing it in different ways. There's no unanimity about how it's being approached. And that's why we decided the Right to Try approach was the right way, because that's actually the way the federal government responded the last time, is they said, oh, states are moving, we should respond to that. So that's part of this as well. So yes, ma'am, I know there's an effort, I know there's interest, and they're in that process. I can't give you details of where they are, but I know it's happening. Thank you, Madam Chairman.
Thank you. Representative McCann.
Thank you, Madam Chair. Along those lines, some of the beef, are we going to run any, bang heads with the feds over this as far as this cell differentiation, using the mesenchymal cells as opposed to what just gets sucked up in the syringe? I know there's been some problems with that, and I think that's what you're referring to between 1.0 and 2.0 and 3.0. These companies that are out of the country, they typically use only mesenchymal because they've kind of figured out that's what works best. And that's why the testimonials for stem cells in the US up to this point are all over the place, because you don't know what you get. You just get what's ever sucked up in the syringe. Are we going to be butting heads with the feds over this?
Senator Barlow.
Madam Chairman, well, I certainly hope so, because we're going to do it the right way. And I don't mean, I'm not saying that in a flippant way. I think that this outlines a meaningful way of safety, et cetera, to get to the good representative's point, that we can have standards and we can provide this therapy in the United States. I think hopefully this will be a model that the FDA actually looks to and says, we can do these things. And actually, of course, they will go further, right? They will go further. But in other countries, actually, if you talk about the phase 1, 2, 3, in other countries, when you get to phase 1, you can offer it to the broader public. It's no longer after you get to that safety. So we just have a different approach we have to go through all the process before you can provide it. And in other countries, they're at different stages. And I don't know all the details, and each country is, of course, a little different. But I think that, I don't know that we're going to be butting against it. I think they're going to be monitoring. And if we do it properly, and our physician community that wants to participate does it properly, and we have no adverse effects, then we will, I think we will be able to provide this medicine without the pushback that you may see. The pushback, Madam Chairman, if I could, when there are adverse impacts, and you can read about them if you go online, you can read about them, it's generally when someone is cutting corners. We're trying not to give them corners they can cut with this bill. Thank you, Madam Chairman.
Thank you. Follow-up, Representative McCann.
Thank you, Madam Chair. To take it a little bit further, what I'm worried about is are our physicians going to end up on the wrong end of the stick with the feds because they differentiated the cells further than what we've gone up to. I just don't want to see our physicians get into a bind that has happened before. So,
Senator.
Yeah, Madam Chairman. So, and I appreciate the caution. First of all, no physician has to do this. They have to be comfortable with what they're doing and have to meet these standards. And then certainly they are probably getting legal counsel about, what their challenges may be. There are things happening in other states, as I mentioned, other states have adopted this, and there are discussions in other places that hopefully will guide this. We're just trying to open a door with this legislation. Folks can choose to walk through it, but they're walking through with their eyes open and they know at least the basic standards. So, Madam Chairman, I think this is a process, as you know, and I truly do, going back to the original question from your good colleague, I do want to push the federal government to actually take this up and move things forward. And hopefully this approach will help do that. Thank you.
Thank you. Committee, any questions on the bill, or the structure of the bill? Representative Clouston.
Thank you, Madam Chair. Thank you, Senator Barlow. So I've not had a biology class in 38 years, if I did my math correctly, but so the advantage of these cells versus just the way it's happening now, the mesenchymal cells, I think they can become bone marrow or white blood cells, red blood cells. They can be used for tendon or ligament. So now we can target, with this approach, we can target the therapy that we're after versus just kind of a draw and shoot.
Senator Barlow.
Madam Chairman, so I have some medical background as well. My last biology class was probably longer ago than that. But in visiting with the researchers and the folks that are doing this work, I think there's probably there's multiple ways these mesenchymal stem cells work. They work as recruiters. So you place them in the tissue, the diseased tissue. They recruit the other natural cells to that area through messaging, signaling, et cetera, exosomes, et cetera. And then they also have that potency where they themselves may have some differentiation ability themselves to do something. So it's a combination. And most people would say that the science is still evolving on understanding the exact mechanism depending on the disease we're dealing with. And interestingly enough, as I learn more about this, much of that science, some of that science is happening at the University of Wyoming. The basic research. So now we're talking about the basic research, right? The applied science is what you do when you put it in a human, and then you measure the outcomes, you measure the efficacy, et cetera. But the basic science, I think it's all of the above, and that's why it's 2.0, 3.0 is which effect are you getting depending on the cell and the area and the disease are you getting? Are you getting the cells themselves differentiating and providing the healing factors? Or are you getting the recruitment ability of those cells to bring the other cells from other parts of the body that have that ability to that site to do the repair, to do the regenerative medicine approach? So I think it's a combination. And I mean, we can certainly get scientists in the room. There's none here, but then you're going to really geek out. And it's fun, but that's a whole different thing. But thank you, Madam Chairman.
Thank you. Committee, any additional questions of the bill sponsor? Okay, seeing none, thank
Thank
you.
Thank you, committee.
Don't go far.
Go.
Okay. Any government agencies that would like to testify? Good morning. If you'd state your name and your take on this bill.
Good morning, Madam Chairman, Representatives Kevin Bonneblust, Executive Director of the Board of Medicine. And want to just go ahead and give you some quick rundown. I want you to get to the folks who are actually living with this and wanting to have this treatment, but I do think I want to make some points so you know where the board's coming down. And before I get started, it's a little early in the morning for me to figure out Roman numerals, but I would say that on page 5, there may be a typo. I'm still going back and trying to remember if 2 little v's means something, but I think there's an extra v there on line 9. So unless my Roman numerals have failed me yet again. So with that, Madam Chairman, I'm going to keep it real short and sweet. This does not put the board in a position of picking winners and losers. It just doesn't do that. The whole point is to help get a registry, as Senator Barlow said, of those who are saying, we're going to follow these rules, we're going to fit for this exemption. We're going to adhere to these so that you're protected. It doesn't prevent anyone else from, practicing with stem cell therapy, but this is sort of a little niche that's been carved out because there is no prohibition on stem cell therapies in the Medical Practice Act anyplace. So it's really what this does is just simply makes that clear. There's not going to be an adverse consequence if you comply with this bill and so on. You've got the protections and if you've registered with the board. It's very narrowly written, and that is great. I would say that, for instance, Senator Barlow called attention to the language on the middle of page 7, line 10, where the board cannot act solely on the physician's recommendation to use stem cell therapies. I would say that is, call that to your attention because that's the language that has been used, for instance, in the off-label prescribing bill and some other bills that this body has passed. And the idea being that you can't discipline for doing off-label prescribing or using stem cell therapy as in here. But if you violate one of those other provisions of the Medical Practice Act that the legislature has said people need to follow, meet the standard of care, keep records, do all these things, then you're still exposed to those and you still have to comply with those. So that language is very nicely crafted and I'm glad to see it's made another appearance here. And for us, the registry is going to be able to be easily set up. We're not going to be in the position of saying, oh, you qualify, you don't. It's going to be a very simple, okay, you say you're doing these things. And so by signing up for this registry, you're saying you're adhering to this statute. That's on our webpage. It's not the good housekeeping seal of approval. It's simply that this person has said to the board, I want to be known as providing this kind of stem cell therapy. So it's the board, the rules will be very simple. It's pretty much just a checkbox, as the Senator pointed out. And so it should be very easy for us to implement. Hence no fiscal note, thank you. And then just a couple of other things I wanted to point out if I could. And that is the discussion of supervision. And on page 6, where there's discussion of administration by a physician or under the direct supervision of a physician versus anything else. When the board looks at direct supervision, that means the physician, it's basically over the shoulder supervision. It's not, you know, I'm off on a cruise and you called me and said, hey, I'm doing this with Mr. So-and-so, is it okay? No, the physician is there. And so that is, I think, a wise choice at this point as this emerges. Time moves on, see how it works, but I think that's a good protection to have at this point. And then last but not least, to Representative McCann's question about complying with FDA versus, you know, the multiple masters, the state master, the federal master. I would liken it a lot to the compliance with DEA rules, where in Wyoming, you have to adhere to the Wyoming Controlled Substances Act, but you also have to follow the DEA's rules. It's not impossible, but you have to be aware of both, you know, depending on what you're doing, if you're dispensing in your office, doing things like that. So I think that's going to be the little bit of ground that physicians already navigate in some areas like controlled substances. I don't think it's insurmountable, but I think they need to be eyes open to it, which hopefully, as Senator Barlow said, they'll have some guidance, maybe some legal counsel to help them. So with that, I have nothing else to say, but happy to answer questions if you have any for me.
Thank you, Mr. Bottomless. And we have an amendment that was provided by LSO regarding the correction that you mentioned on page 1, line or page 5, line 9, regarding the Roman numeral numbering. But there also is another one, and I just want to draw your attention to it because it does mention the board. So it's on page 1, line 10, after the word specified. LSO is recommending that we insert amending the powers of the Wyoming State Board of Medicine.
And Madam
Any
Chair,
issue with that?
absolutely not. That's belt and suspenders to make sure that indeed the enabling language does say that, oh, by the way, we are touching the Medical Practice Act. So if that makes LSO sleep better tonight, I'll sleep better too.
Thank you, sir. Any questions? Representative Clouston.
Thank you, Madam Chair. Thank you, Director, for being here. Just a question, we'll call it the current stem cell 1.0 and the direct supervision. Do they have to apply to that right now or not? I guess is the question. Thank you.
Sir.
Madam Chairman, Representative Clausen, great question. At this point, there are very, very few areas where there is expected to be direct supervision of anybody in those words. But what it is, it's a variable standard. It depends on what the procedure is, what the training is, especially the physician, what the training is of the person that they're delegating authority to, all those things. So it's very much a case by case because it would be impossible for us to say, if you're doing this procedure all the time, you will do this. this is very narrow and it's really out of the norm. But I think given sort of the groundbreaking nature of this, I don't think that's unreasonable. And I think you can come back and change that if you need to. But otherwise, it's very much a case by case look. And even at this, if a physician really was in over their head and then we're trying to supervise somebody, there would still be problems with it. We'd still have a discussion about, are you properly delegating? Are you able to supervise properly? So it's very much a, there is no one standard size, I guess I would say.
Thank you. Any additional questions, committee? Seeing none, thank you for joining us. Any other government agencies that would like to come forward? Okay, seeing none, we'll go ahead and open it up to public comment. How many of you plan on testifying? If you'd raise your hand. 1, 2, 3. Okay, perfect. We've got 3 chairs up here if you'd come forward. Good morning. Welcome. If you'd state your name, you'll have to press a little button. Thank you, Senator. You'd state your names and we'd love to hear your testimony.
Yes, ma'am. My name is Johnny Crozier. We're from Buffalo, Wyoming.
My name's Hallie Crozier.
We are here to testify in support of the Stem Cell Freedom Act. I think the best way to go about this, I'll tell you Hallie's story. It's long, so I'll make an abbreviated version. Stem cell has changed our life, changed Hallie's life. Hallie was born in 2009, healthy, happy baby girl. We did routine vaccines in the hospital, routine vaccine through 2 years old. I was hesitant and I kind of halted vaccines, wasn't liking it, what I was researching. So I didn't continue and we got behind and at age 5, I found a preschool that I really wanted her to attend. And in order to do that, we had to be current on vaccines. So we went to the pediatrician and they caught her up all in one setting. And it's looking back, the worst decision we ever made. Within a week, she was off. Within 2 weeks, we were back at the pediatrician. Something's wrong. Within 30 days, Hallie was a fragment of what she used to be. She quit talking. She quit eating. She quit socializing. She quit interacting. The pediatrician couldn't figure out what was going on, thinking maybe she had a strange virus from that she had maybe got at preschool. So we started on antibiotics. This continued for 6 months. And we were going downhill and it was terrifying. Switched pediatricians, switched doctors, and he said, we've got to stop the antibiotics. We're killing her with the antibiotics. And by this time, Hallie's she's so inflamed. Yet she's lost half her body weight, yet she's inflamed from meds, the vaccines. We were at an end. Stopped the medicines. Shortly, Hallie started to kind of recover. We saw some color come back. She started eating. She kind of started talking. And then we started seeing the effects of the vaccine and the muscle loss. So our trips started at age 7. We started at Denver Children's. They thought maybe it was a pecus excavatum. She really didn't fit in a box. We'll be fine. You're okay. No problems. Go home. She continued to deteriorate. Maybe 3 to 4 months later, we were at Salt Lake Children. She has muscular dystrophy. There's no doubt in our mind. And they said this within 20 minutes of our visit. And I questioned him, how do we get muscular dystrophy in 30 days from a healthy baby girl? well, that really doesn't, we're not sure. It must be a rare form. Didn't like what I was hearing, so we decided to go to Mayo. Went to Mayo. Within 10 to 15 minutes, she's got muscular dystrophy. And again, I was questioning him, how does this happen? We need a genetic test. Okay, genetic test. Hallie comes back perfect. Hallie, well, it must be just a rare form of some dystrophy that we don't know about it. There's not much we can do. Get her the key to the elevator at school. Don't let her get heavy because she won't be able to walk. She'll be in a wheelchair at age 12. We can offer no help. So we went home. I was a heartbroken mom, and how I eased my pain was to research, and I researched nonstop, and I found stem cell, and it was not available in the United States. So we travel out of country, and the doctors there were more than willing to help. Said their determination was the vaccines that with all of them on board like they were just set Hallie's nervous system on fire, and it damaged her nerve endings so that they couldn't communicate with her muscles anymore. So we started stem cell treatment in 2019. And at this point, Hallie's kind of feeling a little bit better, but she's weak. She has no stamina. People that met her think she's had a stroke. She has a limp, and she has Bell's palsy because of the damage now. And we ranch for a living. So our days are long and they're outside. And Hallie, prior to injury, would cowboy with us all day long. At this point now in 2019, before stem cell, Hallie could ride 30 minutes with us out on the ranch. And then she had to get in the ATV or in the vehicle. There was just no energy, no stamina. Couldn't do it. Got stem cell. Within 2 weeks, Hallie could climb the flight of stairs on our family vacation. Inflammation in her body started to go down. So we continued stem cell treatment 3 times with improvement every time. And again, this is far travel because it wasn't available for us here. And I know many folks don't have the opportunity that we've had to travel out to find help like the stem cell. But it was a game changer for us. And without it, I'm not sure where we would be. We are happy to take questions.
Thank you, Ms. Kosher, for sharing your story.
Yes, ma'am.
Committee, any questions? Representative McCann.
Thank you for your testimony. Just out of curiosity, what clinic did you go to?
Madam Chair.
If you don't mind answering that.
Ms. Kosher.
Madam Chair, Representative, we have actually been to several clinics and they're all right across the border in Tijuana. Not sure I'll mention them by name, 2 different doctors. And I can add, we mostly Americans at the clinic because they couldn't get help in the United States. So the folks you meet and the stories you hear, you actually feel blessed where you are and with the problems you're dealing with. Stories of miracles. I can go on. Most amazing stories.
Vice Chair Allen.
Thank you, Madam Chairman, and thank both of you for coming today. What I was wondering is if you could just explain to me how it works. Like, you have to travel out. Do you have to do any prep before that? And then how long do you have to be gone? And is it your own stem cells? And then is it something that could be affordable to numerous people, or is it something that probably would be very, very expensive?
Sure.
Ms. Kosher, what you're comfortable answering?
Madam Chair, Representative, thanks for the question. As far as affordability, very affordable. Of course, across the border, everything's less expensive, but we've since done in another state in the US and very affordable. And as far as the process goes, there is absolutely no preparation. Hallie's Hallie actually was one of the first minors that they did the stem cell with, where they drew it out of her bone marrow. So she was kind of famous in the clinic, but at any rate, they did sedate. Adults don't get sedated fully to draw their bone marrow, amazingly enough. And they get the bone marrow and then they take it to the lab and they spin it and do this. I can't tell you all the scientific medical stuff they do to it. They take it, come back, and it's for Hallie's situation, it's not orthopedics, it's neuro. So we administer it IV so that it travels throughout her body. And they bring it back and administer it slowly over an hour, watched by physicians. And the worst, Hallie's under anesthesia to get it done. They're just worried she wouldn't lay still long enough to get it done. So the recovery from the anesthesia is worse than the stem cell procedure itself. You're welcome.
Committee, any additional questions? Okay, see none. Thank you so much for joining us this morning.
Thank you, Madam Chair.
Yeah.
Thank you, representatives.
Thank you.
All right, any other public testimony? Please come forward. Good morning. If you'd state your name and we'll hear your
Good
testimony.
morning, Madam Chair, Committee, Andrew Jawanitis. I live here in Cheyenne, born and raised. I'm here on behalf of my mother, who's no longer with us. She had ALS. So I'm not sure if any of you are familiar with ALS, but it is a 100% fatal neurological disease. Just a quick overview of that disease. It starts, I call it a snowflake disease. There's no one similar to another. It starts in a limb and basically deteriorates your muscles interiorly, and then until it removes your ability to live. So my mother, it is a genetic disease. My mother and her mother actually had it. So there's a 50% chance that I may have it as well. But my mom, she obviously resided here with my dad. They were lucky enough to retire and snowbird, quote unquote, in Arizona, in the great Copper State. And they found a unique opportunity there where there was a doctor providing stem cell therapy in that state. At the time, I guarantee my mother would have preferred and loved to have been able to be within a driving distance here in the great state of Wyoming to afford the opportunity to try this. As I mentioned before, with ALS, it's 100% fatal. And most patients with ALS or those unfortunate neurological diseases will want to try anything within reason to help prevent or delay the effects of their disease, right? I think that's a beautiful thing about this bill, the right to try. If somebody is desperate and has an opportunity to delay something, I think they should be afforded that within reason. And I appreciate all of your questions earlier about structure and safety and protecting our doctors and patients, number one, right? I think that's very important. But I also am a firm believer that if a human is struggling, we should have the opportunity to try something to delay. With my mother, those stem cells did absolutely delay her onset progress. The doctors were able to test her swallowing, her hand strength, and her limb strength, so hands, feet, arms, and legs. And she was diagnosed in 2019. In August of 2019, she started that fall. I don't remember the exact month, but that fall of 2019. She died in May of 2023. Her last treatment was that late winter of 2023. When they started to notice that the stem cells were no longer working. Her disease was just taking too much speed. But I can look back and see my mother smiling every time she would be excited or she'd call me and say, "Hey, I'm going to get treatment today." She believed in it. And we absolutely saw results in the delay of that onset progress. It really delayed any progress in the strength of her hands, her legs, walking. She never lost her ability to walk, except towards the last month. Swallowing was the biggest issue, and usually is the biggest issue with ALS. Affects your tongue and all the muscles in your throat. She ended up having to get a feeding tube, and that piece right there really saved her life and broadened her living to about a year post that. But I'm just here to tell her story and really try to effectively communicate that it really did help her and it really improved her mental health, at least that she saw some improvement in a delay of that inevitable. So, Madam Chair, Committee, I'll stand for any questions.
Thank you. And could you repeat your last name? Was it Juanes?
Joannidis.
Joannidis.
Yeah, I don't
Okay.
expect you to remember that.
Okay.
But it is Greek, and my parents were, the Greek community is strong nationally, and they met some Greek doctors at a conference in Florida, who were actually the ones who opened up this place in Copper State, and that was the network. Otherwise, without that community, we probably would not have found something, because they just didn't. My mom just didn't want to go over to a different country. She wanted to stay within the United States. But if there's something here in Wyoming, she would have been the first one in line, as would have. And I hope I don't misrepresent anybody else in this state, but I firmly believe that's important.
Thank you. Any questions, committee? Representative Wasserberger.
Thank you, Madam Chair. Yeah, thank you for coming and sharing your story today with us, Joe. I was just wondering, I think I heard you mention her stem cells weren't producing enough. And so with that being said, you guys went and got that treatment done. Did she do that through her autologous stem cell treatment with her own stem cells, or were they used elsewhere?
Madam Chair, Representative, it's a great question. I actually asked my dad and he couldn't remember. And my mom obviously can't ask her. As far as I remember, it was a balance between her own and umbilical. But I can't say for certain, and I have not contacted that doctor's office to confirm. It's a great question, but I am confident that she would have tried her own stem cells to try it. And that would have been important to her to retain her own and use her own.
Thank you.
Thank you.
Yes, sir.
Committee, any additional questions? Okay, seeing none, thank you for joining us this morning. Ma'am, if you'd state your name and we'll hear your testimony.
My name's Beth Blackwell. I'm here testifying as myself, not representing anyone else. I have written this out because I don't want to forget anything. I'm here to testify in favor of the stem cell freedom bill. It is something I've researched in depth and is something that could profoundly improve my quality of life. In the fall of 2020, I was in my final semester at the university. I was working full-time at a credit union, and I woke up one morning and my fingertips were numb. I didn't tell anyone. I kept working. And then a couple weeks later, I started having what I call an electrocution feeling that would go down my spine and essentially shoot out my toes. This would happen when I bent my neck down. I didn't tell anyone again. I just pushed through it because I thought I was stressed out. Finally, one day at work, the vice president of the credit union was like, "Something's wrong with you. You're not yourself." So we started talking and she sent me to a doctor immediately. That was shortly before I graduated. The week before I graduated from college, I had a spinal tap. The day before I graduated from college, I was told that I didn't meet the criteria to be diagnosed with multiple sclerosis. However, I would eventually be diagnosed. I only had one lesion on my spinal cord, and I had elevated levels in my spinal fluid. March 20th will mark 20 years that I've been living with multiple sclerosis. It took almost 6 years for me to be diagnosed. During that process, I was also diagnosed with rheumatoid arthritis. At that point in time, you were ruling out autoimmune diseases rather than being diagnosed with one unless you clearly showed signs. Thank goodness medicine has progressed and things are better nowadays. But in those 6 years, I went from one large lesion on my spinal cord to 32 lesions on my brain. This has impacted my long-term disease prognosis. I now have black holes where those lesions were. I practice walking every day because early on I was taught that if you continue to walk every day, you create new pathways of how to walk in your brain. So if one is damaged, you don't have to learn to walk all over again. I also live with several other autoimmune diseases that require regular and very expensive infusions every third Friday. To live with MS, I take a drug that was developed to treat cancer 30 plus years ago. It's approved for my rheumatoid arthritis. It's not approved for my MS. I was the one who came to my doctors with this information. I was the one who researched. I was the one who pushed for it because I'm in control of my health. If I don't care, why should anyone else? In the past year, I've had to make drastic changes to my life to improve my quality of life and ability to live outside my job. I've dealt with the loss of my vision, debilitating fatigue, brain fog, severe nerve pain, numbness, and difficulty walking. I lose my train of thought in the middle of talking, can't recall words, and sometimes my inner monologue fails me, and I'm as surprised as everyone else at what comes out of my mouth. Some days I have to talk myself through walking. I have to tell myself, pick up your foot, put it in front of yourself, put it down. Pick up your other foot, put it in front of you, put it down. I don't ever want to use my MS as an excuse, but it does make my life more difficult. I haven't been able to play outside with my son in the summer because increased temperatures and as little as a half a degree increase in my body temperature increases MS symptoms. My son is 14. I've never been able to ride a bike with him during the summer, during the day, because it's too hot and my body can't take it. I recently moved from a 2-story building as there were days that I struggled to navigate the 4 stairs to get in and out of my house. In order to ensure that I could do my job, I had to request ADA accommodations to allow for me to telework during times of increased disease activity and while receiving infusion treatments. There were many weeks, even months, I did not go to my basement where my husband and son spent most of their time because I wasn't sure I would be able to walk back up the stairs. I have often dreamed of finding the miracle to improve my life that didn't involve regular infusions and daily medications. Stem cell treatments are very promising for MS patients who do not receive relief or improvement from traditional medications. Stem cell therapy could be helpful to me now, but it would have been a wonderful treatment option for my mom who was diagnosed with early onset Alzheimer's. It would have also been beneficial to my 1-year-old great niece who was diagnosed with stage 4 cancer. Just having the option to choose stem cell therapy is very exciting to me, especially hearing the last 2 testimonies. It gives me hope as I have always taken charge of my own health and was the one who pushed my current medication. I stand for any questions.
Thank you. Committee, any questions of Ms. Blackwell? Okay, seeing none, thank you for joining us this morning. Any further public testimony? And anybody online? No? Okay. All right, we'll go ahead and close public testimony on Senate File 48. Committee, what is your pleasure?
Second.
Wow. That bill has been moved by Representative Heft, second by Representative Wasserberger. Discussion and amendments.
move the amendment that was suggested by us.
Okay, we have a motion to move the amendments with the technical corrections. You have a copy of that, Mr. Caldwell. Thank you. Second by Representative Heft. Discussion on the amendment. Okay. Seeing none, sensing the urge to vote by a voice vote and a show of hands, all those in favor of Representative Wasserberger's amendment, please state aye. Aye. All opposed? Okay, that amendment has passed. Further amendments, further discussion on the bill. Question being called. Mr. Caldwell, if you'd call the roll on Senate File 48.
This is a roll call vote for Senate File 48 as amended. Representative Clouston,
Aye.
Representative Guggenmoss,
Aye.
Representative Heft,
Aye.
Representative McCann,
Aye.
Representative Ottman,
Aye.
Representative Thayer has left an absentee vote of aye. Representative Wasserberger,
Aye.
Representative Yen has left an absentee vote of aye. Chairman Rodriguez Williams.
Aye.
Madam Chairman, that is 9 ayes.
Okay. Senate File 48 has passed committee, and I assume Senator Barlow, you have somebody to carry it on the House side. Thank you. All right, we will move on to the next bill on the agenda, which is Senate File 19. Epinephrine delivery methods, and this bill is sponsored by Senator Rothfuss. Okay, he is not with us, so Representative Clouston will join us on presenting that bill. Good morning, Representative Clouston. If you'd walk us through Senate File 19.
Good morning, Madam Chair and committee. So pretty simple bill, just updating current language. So currently in statute, if someone's having anaphylaxis, the emergency treatment, Wyoming statute says we can give them an epinephrine injection. Currently, you can now do epinephrine through nasal injections, and they're working on other methods, pills and other things to help stop the anaphylaxis. So no longer would it just be the injection. So what this bill simply does is it takes off that it's not only the auto injection anymore. It states, I'm going to go to page 2, and it's gonna delete the auto injectors, and you'll see that consistently throughout the bill. And if we go to page 4, line 2 and 3, it'll now read identification of appropriate and acceptable epinephrine administration devices or methods. So the thought here is we don't want to just add right now auto injectors, the nasal injectors, because in the future we'll see some of these other methods. So what this bill is basically doing is just taking out the auto injector, allowing for the nasal injections, and then also allowing any other methods that come forward, just so we don't have to rewrite the statute every time. And that is really the basis of the whole bill. So
Thank you, Representative. Committee, any questions of Representative Clouston? Okay, seeing none. All right, committee discussion on, well,
No testimony?
do we have any public testimony on Senate File 19? Okay. It was quiet. I didn't see you two back there. Good morning, welcome. If you'd state your name, we'd love to hear your testimony on the bill.
My name's Janet Farmer. I'm the Health Services Coordinator for Laramie County School District Number 1, but I'm not representing the school district today. My other role is the Wyoming Director to the National Association of School Nurses. So I represent school nurses across the state. We are very much in support of this bill. There are programs available where school districts can have stock epinephrine available, but the way the bill is currently written, we can only use the auto injector. I brought props. Currently, this is a one type of auto injector available. It does have a needle, so of course it's a very long needle. They're actually developed to go through clothing, so it's a big needle. There's anecdotal evidence that people would hesitate to use the epinephrine when they needed it because of fears of needles. So thankfully, in recent years, new delivery systems are out there. This one is called Neffy. That's the commercial name. It actually goes in the nose, like Representative Clausen was referring to. There'll be a lot more. Science is really good that way of developing easier to use methods to deliver these emergency medications. So again, we are very much in favor of this bill, and I would be open for any questions.
Thank you. We have a few questions. Vice Chairman Ottman.
Thank you, Madam Chair, and thank you both for being here. With the EpiPen, or what it was called, quite a few years ago, I got stung by a bee multiple times, and so I was told to get one. At that time, I noticed the increase in price, and also I said, well, I'll buy one and then just keep it till I need it, which could be, and they said that there was where they aren't good anymore. And so can you just kind of update me on the price and the cause and keeping them at school, how that works?
Ma'am, if you have an answer.
Chairman Rodriguez, Representative Ottman, I don't know the cost. If you're to purchase one on a personal basis, they do have an expiration date. The pens expire every year, so they're 1 year only. For schools or public entities that stock epinephrine, there is a program available where we are provided EpiPens or other devices for free. You just have to be part of that program.
Committee, any additional questions? Representative Wasserberger.
Thank you, Madam Chair. Yeah, thank you for coming and sharing with us today. I was just wondering, do you know the difference in the effectiveness of the EpiPen versus the nasal spray? Is it the same, or is one more effective than the other?
Ma'am.
Chairman Rodriguez, Representative Wasserberger, as far as I know, they are the same. I will let my colleague speak more to that, but as far as I know, they're the same. The nasal membranes are very thin, so the medication is absorbed very quickly.
Thank you. Committee, any additional questions? Representative Huft.
Thank you, Madam Chairwoman. Ma'am, I'm a curiosity on my part alone. Have you seen a rise in the need for these? My personal experiences in my business, we seem to be having more and more incidences for the need for an epinephrine. And just a curiosity, how often are these occurrences, or do you know?
Chairwoman Rodriguez Williams, Representative Huft. I don't have any true data. It would just be on a personal basis. I would say that the number of students across the state, especially in my district, the number who have EpiPens has gone up. I know that I personally have given a stock EpiPen once as a school nurse. I would say across Laramie 1, we probably use our stock EpiPens 3 or 4 times a year. And anyone who has a diagnosed allergy would have their own EpiPen or delivery device. We would only use the stock EpiPen for an undiagnosed allergy or anaphylactic reaction.
Any additional questions, committee? I'll follow up. Representative Haft.
Madam Chairwoman, just as a comment, we hire a lot of college students and they bring us epinephrine to put in the office just in case. And so that's just a comment. I've just noticed a rise in its use.
Representative Clouston.
Not a question, but an answer to Representative Ottman's question, actually. When I had to research this for the bill, the Neffys come in a pack of 2 and the average cost is $25 for 2 of them. The EpiPens for 2 of them, as an average cost is about $400. So.
Okay, thank you for your testimony. Ma'am, if you'd state your name and we'll hear your take.
Madam Chairman, members of the committee, Tony Ducklever. I am a registered nurse and represent the Wyoming Nurses Association. So to answer a couple of your questions, we are in support of this bill because anything that allows access to healthcare is a good thing. And we do know that because Neffy is it's being advertised, it's out there, it's available. And when the original statute came out to allow for epinephrine in schools, it also allows for people to not have to see a provider to get a prescription for epinephrine. They can actually just go to the pharmacist and the pharmacist can write the script. So to answer a couple of questions, the website for Neffy actually, I'm surprised, Representative Clausen, that you said it was $25 because the website actually shows that it's $200 for 2 doses. So I don't know, maybe you are getting a good deal. So, and only because epinephrine pens, I checked with my Walmart pharmacist, they do have what they call generic pens. This company that made the original pen, it's just Mylan, when they originally came out, it was actually fairly cheap. Epinephrine is adrenaline. That's all it is. It's just pure adrenaline. And adrenaline is cheap. You can get it in a vial for that, for about $7. But people do not want to break the vial, draw up a syringe, tap it, and then give an injection like nurses do. So they invented the auto injector. And when it first came out, it was reasonable. And then this company jacked the price up to about $1,000 for 2 pens. And the country just went, "Are you kidding?" And so they have come down a little bit because the patent has worn off of the injector style. And so now you're seeing generic epinephrine or auto injectors. But my little Walmart pharmacist said the generic one was still $300 for 2 pens. And I have had a patient who said they paid $1,000 for 2 pens. They usually come in 2s. So, so people have 2, but the shelf life is 1 year. And so that's why they're not good for first aid kits. They're not good to unless you have a stock that you can turn over. However, we tell patients, because they're so expensive, that as long as, and on a real pen, there's a little window so you can actually see the fluid. And so as long as the fluid is clear, the pen is safe to use. So sometimes people will hold on to them for a lot longer, but they are prescriptions. So they really do not go in first aid kits unless you're a school and you're in an opt-in program where they are able to receive the stock pens. Normally people carry these pens when they've had one allergic reaction, because every reaction after that gets progressively worse. So, so often they will get a prescription for initially, and then they'll carry the pen for a long time sometimes. So I hope that answered your questions, Representative Hodman.
It did.
Okay.
Any further questions, committee? Representative Clouston.
Thank you, Madam Chair. Thank you, Tony. So, yeah, so mine were $25 for 2 for the Neffy, but it was after insurance.
Oh.
So I think you're right. I think if you had to pay a cash price, it's probably $200, which is still significantly cheaper than the EpiPens, but yeah. Thank you, madam.
All right. Oh, more questions. Representative Wasserberger.
Thank you, Madam Chair. Does the nasal spray, does it come in more than just 1 dose versus the EpiPen being just 1, or is just 1 spray is 1 dose and that's all there is in the 1 nasal spray?
Ms. Declever.
Madam Chair, Representative Wasserberger, 1 dose.
Thank you. All right. Thank you, ladies, for joining us. Any further public comments? Okay. Oh, we've got one more. We're on Senate File 19. Good morning. Thank you for joining us. If you'd state your name, we'll hear your testimony.
Madam Chair, Boyd Brown, I'm the Executive Director for the Wyoming Association of School Administrators, which is all the superintendents across the state. So we're in support of this and think that it gives us a little more flexibility to be able to do it. So with that, I would answer any questions that I can. Not real knowledgeable about the subject, but we do support it.
Thank you. Any questions of Mr. Brown? Okay, seeing none. Thank you for joining us. Any further public comment? Anybody online, Mr. Caldwell? Okay, seeing none, we'll close public comments on Senate File 19. Committee, what is your pleasure? Bill's been moved by Representative Wasserberger, second by Representative Gugemas. Discussion amendments. Question being called. Mr. Caldwell, if you call the roll on Senate File 19.
This is a roll call vote for Senate File 19. Representative Clouston,
Aye.
Representative Guggenmoss, Representative Heft,
Aye.
Representative McCann,
Aye.
Representative Ottman,
Aye.
Representative Thayer has left an absentee vote of aye. Representative Wasserberger,
Aye.
Representative Yen has left an absentee vote of aye. Chairman Rodriguez Williams. Madam Chairman, that is 9 ayes.
Okay, Senate File 19 has passed committee. If one of the co-sponsors is willing to get with the prime sponsor to see who can carry it on the floor, that would be great. All right, we have no further business on the agenda, so the meeting is concluded. Thank you.